During an health crisis, we are very much focused on the actions to be taken because that is the priority. But our ability to respond to a crisis actually has the roots in many activities which are focused in raising public health awareness on the true health problems. Capacity building in response, monitoring and having surveillance systems for monitoring the health of the population are essential elements. However, our ability to respond to the health crisis has different ingredients which must be taken into account much earlier than the crisis at the end explode. We could make a sort of list of what are the major points to be kept in mind during and before the health crisis. The first one is the trust and confidence. We know that all the work to be performed in managing the health crisis must rely upon the mutual trust and confidence among professionals, between the institution and the general population, and this is essential because the response to a crisis is not only of one actor, must be a community response. A second very important point is networking. If people is not used to work together, will not be able to work together during a crisis, and this is very much relevant for health professionals. We should build networks of health professionals already able to work together before the crisis hits, and this is a very relevant point. The third point is to develop instruments, but it is very naive to think that the instruments themselves will be a response relevant enough to stop the crisis. And for instruments, I mean having the plans. In Europe, we have worked for many years on the pandemic preparedness plan much before the H1N1 pandemic came. And at the end, most of that plans came out to be ineffective or inefficient because they were too rigid and they were not actually tailored on the true needs. So the instruments, we may have plans, we may have surveillance systems, system for analysis, system for capturing information, but instruments themselves are just one of the components of the response. The other one is that any plan we make, we know that for the exercise already made, that the preparedness plan usually have a first point, which is that one of identifying roles, infrastructures, institutions, responsibilities. But actually we should focus more than on the true structure, which in a situation where there is a true crisis, the structures may not remain the same or may not have enough power to respond, and therefore we should identify in our preparedness plan what are the crucial functions to be saved, and different structures maybe should be trained or adapted to absorb to that functions to ensure that the response can be still released. This is much more important when we talk about health systems which may be overstretched by other constraints and local situation. An additional point to be taken into consideration is flexibility. Most of our preparedness plan did not had at the time in the pre-pandemic period, had no taken into consideration flexibility, which is the ability to adjust for a changing situation. If there is an health crisis, for sure the situation could change, and it is very relevant that this has to be adjusted for. An additional point which is becoming of growing importance is the society involvement. All our response must take into consideration the society need and also request And therefore we should meet the expectation from the common people, also because then we ask for them to cooperate in response to the crisis. One example could be the current Ebola outbreaks, where we know that the relevant determinant of how the infection spread was the burial ritual and the cultural way of doing this. And we know that in that setting, recommending of changing their habits is something very difficult, and therefore we should work on creating expectation of what can be recommended, and also in answering the crisis, taking care of what is their need. And a very relevant point is that all our plans must be intersectoral. Most of the plans recommend a sort of generic interoperability, but this means that what is done as a preparedness in the health sector must be known and agreed upon also in other sectors, and everybody should know what the other can do. And my final point is to invest also on our ability to communicate. Communication is one of the major problems so far, because a bad communication can build a sort of false, real picture, and then it is much more difficult to work under that situation. Not always, but in this period, we know that we are working in many situations in the edge of the scientific knowledge, of our scientific possibility. And therefore we have to face how to communicate uncertainty in order to not enter then in the situation of loss of confidence when what we have said, maybe it is found not to be fully and always correct, because maybe is not completely know how to do something. We feel that in this general picture, with all these different components, there are different roles, different actors, different players, and the National Institute of Public Health, definitely in each member state, can be a good collaboration, can create a good collaboration on this, as they are used to work on coordinating response at national level and working with the local health units at different level. And definitely this is a game which can be done by different actors, but definitely the framework and the general investment in resources also for stability and peace is under the responsibility and therefore the big contribution of the European Union.